be a candidate for it. I know you're not ready right now. But what we see that as we get older, the hair thins out, correct? So there are a few types of hair losses. So the common ones, what you see or what I see is from aging. So the hair follicles get thinner and they just fall, right? So just diffuse hair loss. Then you would have, you must have heard or seen people who have patchy hair loss. And that can happen as young as few months old. Like 6 months old children can have it. And stress is number one factor. And doesn't matter how, but if they are stressed, they can actually have patchy hair loss. Fortunately, women will not ever go bald, but balding can happen. And then there's another type of hair loss in which you start seeing hair receding from here. This is the receding hairline. Some of it is genetic, but many times we actually lose much more hair. And sometimes you will see when we get older, our hair is going thinner and thinner. So there are several types of hair loss. So whichever type of hair loss it is, fortunately, the PRP, that is the plasma, the platelet-rich plasma, and that is the best treatment. It's done locally here, and we do it 4 treatments, 4 weeks apart. Okay, so what do we do in the treatment? So I'm just going to demonstrate it, okay? I'm not doing the procedure, but I'm going to show it to you. So I'm going to take your arm out.
Oh, my
okay,
arm,
okay.
yeah.
I'm just showing, okay? We are just pretending.
Okay, there we
So
go.
we just pretend that we are actually going to tie your thing like this, okay? And we draw your blood from here, okay? So we have, and this is the kit we use, okay? This is the PRP kit. And let me show you the syringes. 1 second. Let me show you. So we actually draw. So it comes with syringes like this, right? So we have these syringes. So we draw the 30 cc's of your blood. We add a little bit of blood thinner into it, and we take this blood, we actually put it into one of these containers, okay? And then we balance it with the other container. We bring it here to our machine, which actually spins the blood, okay? What it does is, this is the machine, this is our centrifuge, so we put that in here and we spin it. After spinning, the red blood cells are going to separate from the plasma, and we take the plasma and we bring it out, and we spin it again so that we can get the growth factors, okay? And the plasma has the growth factors. You know how you
So
grow
this is your own plasma?
Yes, that is the best part. And that's why this is your own plasma. And this kit here ensures it's all the closed system. Nothing goes out, nothing comes into your body other than your own blood.
Oh.
This is why this is so important. The PRP is your own blood growth factors, your platelets.
My platelets have growth factors still?
Yes. See, this is how you became from little baby, you grew up to a tall person. The growth factors. So the growth factors are nurtured by what you eat, what you live, what toxins you are exposed to, and that's how we grow, right? So this is the growth factor in your body. And where else can we find them except in your own blood, right? So this is why, and these PRP that we come out with, and that comes out in these syringes, which is almost like a gold color. So we draw that, and that's what we can inject in your body.
So you're re-injecting stuff you've taken out.
Yes, that's the beauty of it. And it's completely natural to your body. You will not have any reactions to it, no allergies. And because it's a growth factor, if we put it in the hair area, in the scalp, it will grow the scalp, right? It will, grow the hair. Whatever underneath there is, it will grow. When we put it in your face will, the tissues, the collagen, they will grow, right?
Oh.
If we put it in a scar, the scar will get healthier because your own growth factors will help. So we can actually inject your own PRP anywhere starting from your head to your toe. It's been actually used for a very long time for joints.
Will it do my knee?
Yes. In Arizona, they are injecting the knees. Everybody. I haven't started my injections in knees yet, knees or shoulders, but I've been looking for conferences to go because I have trained to inject the knees. I just haven't done it. So now I can. So it is this kit. This kit does it all.
What does the kit have?
The kit has these, okay? It has sterile needles like these, and it has sterile bottles like this.
Oh, I see.
Because
All
it's a
that
core
you're allowed here.
system, it is one person specific. So if I'm ready to do yours, I'm going to open a fresh box, I'm going to finish everything, and I'm going to draw your blood with the tourniquet inside and do all spinning, bring it back, inject it, and then I go out of the room. So this way it ensures that we are not, taking the blood products out of this room. Right? So this is why we are very fond of this. And when we do the face, of course this is plasma, this is liquid, we need some entry point on the skin, right? So on the scalp we directly inject, on the face we can inject it directly also. But something else we are able to do is called micro needling. So in the micro needling, what we do is we use this. This is a nice disposable needle, okay? And this one goes on a pen. It's called Rejuva pen. Is the pen inside there? It is electric pen. So what it does, it makes little needles, little, channels on your skin, and then we will actually put your own plasma on those channels, right? So this is called Rejuva pen, which is part of our micro needling, and we can use that on scalp also, but usually this is the pen, okay? So this is the pen that comes, and it has, we can measure it how deep we want to go on the skin, and then that's what we use, okay? So this is the pen we use with the micro needle, and then we put your plasma on top of it.
So excuse me, when
Yes.
you put it in here,
Mhm.
you're gonna put a little needles?
Yes,
Hit several
yes,
times?
we
Is
can,
it painful?
yes. No, we will numb you. We
Okay.
have to numb you for all the procedures because the pain can be there, so we need to numb you, okay? And we have a 20% betaine, cream that's actually available only in the doctor's offices mostly because it's a prescription cream, and we apply that, so you sit with the cream on your face or on your scalp for about half hour. It really numbs it pretty well.
And once you do this plasma,
Mhm.
how long does it last?
Oh, so last, okay. So it depends on your type of growth factors and what we are trying to heal, right? So anything we do, we will do it, but it has to be repeated at least 3 times. Because think about it, one time doesn't fix it all. Because it has to grow in layers, right? So first time we do, it will get better about say 30%, second time 70%, then ultimately. So minimum 3 times. Maximum you can do 5 times, and some people do it, all the time. Every 2-3 months they'll do it. Because it's your own blood, really, there is no reason not to do it. There's nothing, negative about it. And if you don't want the needles, then we can just directly inject it on your face too. With your needle. Because you are numb, you can actually inject the plasma. Right? So now you get it, right? That's what it is all exciting about. Yes, but yeah, scars. We can inject the scars very early on with your own blood, and they will heal beautifully.
Really?
Yes, yes.
So doctor,
Okay.
like this scar,
Uh-huh.
you could do it?
So now this scar, this is an older scar.
Yeah.
So for this type of scar, it has to be a laser.
Okay.
Because a little bit, how long has the scar been there?
2015?
Yeah, 2015, so
Yes.
4 years. So if it was fresh, like within, within the year, 6 months, then we can inject it. It
Okay.
will have much more effect. Such an older scar, we should laser it. Because laser what it will do is it will displace the fluid and it will bring the scar closer and more flush with your skin. Okay? So yeah, laser, something like that, the laser has to be done.
All right, thank you.
Yeah, yeah. But any other scars and even the tendons and the joints, we can inject with the PRP.
Wow.
Yeah. And I know that, we have a model for the hair. We are going to have a model for the hair, right, again? And then we will be doing the hair area, because that's one area I really want to show you, how it's done. And the other thing I just want to share with you, right, for the hair is called Viviscal Pro. It's a shark cartilage. Okay?
Wow.
Yeah.
Shark cartilage?
So, and it grows your hair.
It's a pills, right?
It's pills.
I'm taking that,
Yeah.
and it's growing.
Love it.
I love it.
Okay, I want you to say that. Can you, Angie, take her? Can you tell
Testimony.
them? Can you say?
Testimony.
Yeah.
I love these pills. These are amazing. I seen so much hair growing right here because I was losing, and the new baby hair, and it's getting longer and longer. So I even finding hair all over my body. So I found a big hair right here. I said, oh, but you know what? Mainly it's growing. This is where I having the pills that are doing excellent job. I love
Thank
this.
you so much.
love it.
And same thing. So Viviscal Pro, it's a cartilage from shark, and it's actually grown very responsibly.
Yes.
You know, so I want to kind of disclose that because my kids are, Mom, that's a shark cartilage. You know, because we get worried about sort of harming other creatures. We are not, because this is grown very responsibly. But I have to tell you a little story. I wore extensions for a while, and patches of my hair came out. They were like, they wouldn't grow. So I started, I'm a vegetarian, but I went for it. I'm like, no, I'm going to take this. And I'm taking 2 pills a day. You have to take 2 pills. And it's amazing. Everybody tells me that my hair looks fuller. We all will have hair damage. We can't escape it, no matter how, sort of carefully we take care of it. But this, taking 2 pills, within a month you will see the results.
Yes.
Within 1 month you see
Yes.
the results. And we have the professional strength, so this has got added biotin in it, and that's even better. So I think it's available elsewhere, I'm not sure where, but in our office we definitely have the professional strength. So we are loving it, right? This is one thing we have ordered 5 times now, and we run out of them. So this is something really, really I recommend for hair. Hair is tough. Hair is tough. Hair grows in places we don't want, and it doesn't grow in places it does.
Right.
So we cannot win. But I don't know any women who haven't colored, straightened, curled, pulled, pushed, whatever. We all have done it, even if we have been told. So I think ultimately we all will need hair care.
Even without these pills before, I used to have hair right here. The hair comes with the pills right here. So of course I had to clean it up.
Right.
So with this, I love it because it's growing in the right place.
Right place.
The
I
hair.
agree.
And I feel my hair is getting
Fuller.
full.
Yes. And same here. I couldn't be without my extensions because I was losing. So I first had the artificial one, then I had clip-ons and blah blah. Now I have nothing. I wake up and I used to be like this so many years ago. So thanks for Viviscal Pro, and I'm so glad we met this lady and she introduced this to us. Information is very difficult to be gained. I'm a book reader, and I tell everybody I go to many conferences, but somehow we didn't know about this until 6 months ago, and since then we have become a big fan, and I would recommend everyone. I yet to see anybody reacting to it because everybody can manage this. So I think those are the 2 main things for us in hair care.
So what does it do for joints?
Joints, it will rejuvenate the joints. Your PRP has, so the growth factors. So let's talk about them one more time. Like I said, when we are little, we grow, right? So think about it. How do we grow? Growth factors, right? So growth factors come from your nutrition. We have all the wiring for it. We are born with, all these areas that can be growing, but we need the nutrition. And the nutrition gets to these areas and then they turn into growth factors, right? So we need growth factors to grow. So we have them in our blood, and we have it in the plasma in the blood. Okay?
It's
So
by
the-
what we eat.
Yes,
When we intake
exactly.
smart food, like
Yes,
salmon.
exactly. So whichever tissue we will put in the growth factors, that particular tissue, the innate tissue will grow.
So like bone or cartilage will grow in your knee?
Yes. I mean, it will. So here's the thing. If you have a damaged cartilage to the ends, I don't know how much it will grow to the normal. But if you have some left and we can grow them, then yes, we will. So you have to have some baseline left. If you're totally damaged the cartilage and you are totally ready for a knee replacement, maybe that's too much gone. So it's earlier on in the disease process, when you still have your cartilage, of course you can have your PRP injected.
That's interesting.
Yes, so mild to moderate, yes, you can. In fact, PRP is being injected on private areas, which we call private areas. Like for example, women, right? So we can inject on the vulva. In men, we can inject on their private areas for any like problems with growth or any pain, and there are other indications for it. But we are safe to do that because it's their blood. That's the whole thing. It is your own. We are not adding anything. For the hair, for the scalp therapy, there is a thing that we can add. So I was just going over that. We do like a series of 4 times for the hair. So after 2 times, just in case if it hasn't done what it needs to be doing, then we can add something called A-cell, which is, I think it's a pig or some other animal growth factor. So at that time, we will let you know that we are adding, but those are also produced without any immunogenicity. Those are not immune response, as far as I know. But if we do not add anything, you should still grow your hair. And actually, PRP in hair, growth is #1 topic right now. You can see all the scientific journals are actually publishing cases after cases. So now we are very confident. And actually, we had a demo today, but I didn't get to meet her, and she's on blood thinners. Now, blood thinners will bleed, and if they are not prepared for it, and if the cause for what they are on it is much significant than getting the hair restoration, then I think we should plan it properly. That's why we couldn't do our demo today. She definitely would use it. She definitely has lost a lot of hair. However, we just blood thinners because it will bleed. And I think, we have to take care of medical issues also, right? But yeah, so we are loving this PRP. We can inject anywhere. Women have had PRP injected in the breast area for cleavages. It's your blood. You tell us and we inject anywhere. Eyebrows can be injected for growing the eyebrows. Anything that's going away, we can inject and it will grow. So it is some clinics, I believe, on East Coast only run with PRPs, just PRP all day long. So I think on this part of the woods where we are now, we are just introducing it. We are just really introducing it. But I'm loving it. So thank you all for coming and listening. But yeah, you can always have it injected. Shoulder is very popular right now. And I'm going to think that I'm actually planning to go and attend a course because I used to inject shoulders. When we were family medicine residents, we injected a lot of shoulders. And then subsequently we just haven't. But I think with PRP we should go back and do it again.
You were injecting with a steroid before.
Yeah, because we always have injected steroids.
Steroids, that's.
But now, we are doing a PRP. It's your own blood. Your own platelets.
They do a lot of PRP with sports injuries.
Yes.
They've been doing it for
the longest time.
For years.
And across the state in Arizona, they pretty much, inject, so where did PRP start? You know where PRP started? So many years ago, dentists started it.
Oh.
Yes. Dental surgeons started using platelet-rich plasma.
For what?
Think for teeth, for gums, for regeneration of gums. They started this whole thing way back when. And we just, we said, wow, it works, And then slowly it has gotten to every part of the body, every part of the body. Because the only thing that is one step higher will be stem cells. Growth factors and stem cells.
Right.
Oh, stem cells.
So stem cells therapy is a whole different novice thing. People have asked me to be in my office, but I'm not prepared for it yet. I'm just enjoying my PRPs and that's pretty much it. But that would be ultimate. But a step before that, for growing, growth factors. Amazing. Yeah. And it's your own. It's your own. That's the best part of it. So people do every 4 weeks, they can do it. There's nothing wrong as long as they are drinking, eating, and producing their own blood cells, because we will remove 15 ml of blood, 15 to 30 ml of blood. But that's pretty much it. Interesting.
Yes.
Very.
Thank you.
Very interesting.
Yeah, and I think we will be doing, and maybe whenever your brother is ready, we have, and I think next door also he's looking, now I actually went over what we are looking for, so he's going to send us a demo or a patient. and client, and then you want yours done. So I know
Yeah.
you are in my
My
mind.
face.
You want my face, so you are
My
coming
face.
in. Yeah, we are doing it. We are
Yeah.
going to do it.
Yeah, so
Yeah.
you actually take out 30? Wow, that's,
So yeah, we have to take 30 ml of blood.
that's quite a bit, isn't it?
It is quite a bit. That is the only thing. You have to be healthy and be able to. So that's why we do it every 6 weeks.
Right.
Yeah, we do have to remove 30.
And you know, when
Some
I do
places
plasma-
remove less,
Uh-huh.
so but they get less plasma.
Mhm.
So we can also do 20 ml, then we get only 5 ml or less. Even with 30 ml, the real good plasma is only 5 cc's.
Wow.
5 to 7,
you
because
said-
that's where the concentration of growth factor is.
And what color is it? You said it's actually,
Goldish,
it's actually
gold.
a gold color.
Very
That's
gold.
interesting.
It's so beautiful. Yeah, it is. And I'm going to do it on you, Kathy. I know you're
Thank
so
you,
interested.
doctor.
Next
I am
time is
very
your turn.
interested.
I promise you.
Well,
I
I tried to
promise
get
you.
it. I had a
Yes.
tendonitis, and I
You
ended up
wanted-
having surgery. And I tried to push for the. Well, the insurance wouldn't pay for it.
I know, that's the only thing.
That's the thing.
But I'm
pushed
going to
and
get
pushed.
my certification, then I'm going to do your shoulder too. I mean, your elbow. But I know I'll do your face, I promise you.
Okay.
I'm just letting yours set in,
Yeah.
so next will be yours. But you look amazing already.
Thank you.
Yes.
Yeah, thank you. I've had some
Yes.
injections in
Oh, you
Botox,
did,
so.
But it
Yeah.
has done such a great
Yeah.
number, right? I mean, you
Really.
already from the last visit to this
It's only
one,
been, what?
2 weeks?
Not even.
Not even. It
Not
looks
even
amazing.
2
And I
weeks.
have to tell you,
10 days.
everything you've done will look better and better.
Mhm.
It just adds up.
Mhm.
We are like layering it.
Right.
So someone asks me, oh, one treatment will fix it. What fixes in one treatment?
Right.
My roof, we
Right.
got it done 3 times and they're telling, and then it's leaking.
Still
And I'm
leaking.
like, come on, So nothing it gets done, especially my lasers. They are pretty strong. We can't go too deep in one laser. We'll make holes, we can't. So we have to do layer by layer.
Mhm.
But everything you do is adding up to your beauty, of course.
Yes, absolutely.
Right.
Well, thank you, doctor.
So thank you.
Thank you.
That was amazing.